Aside from the physical toll of the wars in Iraq and Afghanistan has come a mental cost. Depression, suicide, and marital problems plaguing the military on a scale not seen since Vietnam. The Pentagon's been in beg, borrow, and steal mode to get more mental health professionals, but just doesn't have enough therapists to handle the load. Only 1,400 in uniform on active duty, plus about 3,000 available under the military's healthcare network.
Much is being done by the Department of Defense and the Department of Veterans Affairs. But the need to help these men and women goes far beyond whatever any government agency can do.
Which is where the civilian world comes in.
There are over 400,000 mental health professionals in our great country. Clearly, we have the resources to meet this challenge.
Psychologist Barbara Romberg founded Give an Hour, which asks mental health workers to do just that, volunteer an hour to help troops and their families. Psychologist BRENNA CHIRBY's been doing it for a year.
I mean, it's only an hour of your time a week. Like, how can you not give that to these men and women that are, going overseas and fighting for us?
About 1,200 professionals are working through Give an Hour to provide help, and the group hopes to add some 40,000. It's the biggest of many groups across the country offering varying levels of treatment, from counseling to yoga. And CHIRBY says the need won't go away soon.
Soldiers are still going over and soldiers are still coming back, and families and children are being affected.
While the Pentagon acknowledges the volunteer groups do give troops and families more options for care, it does not endorse them, saying if civilians are willing to help, they might want to join the military's healthcare provider network instead of just doing it on their own. Sagar, Meghani, The Associated Press, The Pentagon.